we have a very serious topic. And I'm sure that women out there all over the world would want to tune in to this episode of the Tammi Mac Late Show. Children often ask how babies are born or how babies are made. And when that question is posed to a parent, they probably respond by saying something like, babies are made when a man and a woman love each other very much. It reminds me of that Stevie Wonder song, Isn't She Lovely? Made from love. But in reality, it is not always that simple, right? Sometimes the stork really does deliver the baby. The United States Department of Health and Human Services says about 11% of women of reproductive age in the United States have experienced fertility issues, and Black women are twice as likely as white women to experience infertility. But infertility does not only happen in women. Did you know that? 9% of men in this country have fertility problems as well. Tonight, the business of being Black is infertility in the Black community. Please welcome scientist and reproductive endocrinologist, Dr. Erica Loudon. Hi, Dr. Loudon.
Hello, how are you?
Journalist and board member of Resolve, the National Infertility Association, Nichelle Poston. Hi, Nichelle.
Hi, thank you for having me on the show.
Writer and speaker, L'Oreal Thompson-Payton. How you doing, L'Oreal?
How are you?
Speaker and author, Frances Jones. Hi, Frances.
Hello, how are you today?
Good. And youth librarian and founder of the Broken Brown Egg, Regina Townsend. Hi, Regina.
Hi.
So the first question, as I ask each and every night on the Tammi Mac Late Show, is why should Black people care about infertility? Why? Why should Black people care? Doctor?
Black people should care because it affects us disproportionately. So unfortunately, like everything that I learned in medical school, it's always Blacks and Latinos. So why should we care? Not reproducing like they used to. So we have to replenish the earth, and we're behind, actually. And that's one of the stigmas that we have to break, that we're not infertile, that everything's good. We're like these baby making machines, when actually, as you mentioned in your introduction, we have a higher rate of infertility, but we seek less of the treatment. We're not getting that care. And so why is that? We have to address those issues through empowerment, education, and that starts within the community and then helping within the families as well to kind of educate and move that along in clinical research, as well as in how we advance that care in our practices.
L'Oreal, why should Black people care?
Because if you think that Black lives matter, then the very act of trying to produce Black life should also matter. And for me personally, it was going to the waiting rooms and not seeing anyone who looked like me. And so you take infertility, which is already this isolating experience, and it becomes amplified when you look around and you're like, oh, I'm the only one in here. And so I just believe that representation matters always and always. And this is just as important.
Right. Nichelle.
Yes, I agree. Representation does matter. And I want to add to what Dr. Loudon says, or just recently said. The one thing that I think we should take from this, and we can talk about Black women and infertility for days, but Black women suffer more than any other race from fibroids. And that is one of the things that, we don't talk about enough in our community. Sometimes the quick fix is a hysterectomy, a doctor may say, and that's not a quick fix. That's probably one of the last things you want to get done because you want to produce. And so, fibroids more than ever, about 20%, if I'm correct, about 20% of us suffer more than any other race from fibroids. Fibroid tumors are benign tumors, I must say, that are in our uterus, the cervix, and we need to bring more attention to that. But yes, representation matters, and I'm just happy that all of us are here to talk about it.
Yes, indeed. Regina, why should Black people care?
Really, because it's bigger than babies. I think we tend to get lost in the idea that you want a baby, so have a baby. And as a Black person, we're super fertile, so you shouldn't have any problem with it. When in reality, we're dealing with endometriosis, fibroids, polycystic ovary syndrome, all kinds of other issues that affect us that lead to us having more of a prevalence of things such as heart disease. Polycystic ovary syndrome affects that as well. So if we keep focusing on it as just baby, we're going to miss some major health markers that we are also disproportionately affected by. So we have to look at it as more than babies, and we also have to look at it as a social justice issue. Reproductive health is important, but so is reproductive justice, and that includes the right to have or not have children. So we really need to be talking about this more and removing some of the stereotypes and stigmas that we've allowed to kind of direct us.
I love that. Bigger than babies. That's incredible. Yeah. Yeah. Francis, why should Black people care about infertility? Look, don't we have enough Black people running around here? We got enough Black babies. Why should we care?
The reason that we should care is because building families is the strength of our communities. And when we are denied something that we actually should be able to do easily, it begins to come and cause separation in the homes and separations in our hearts. And when we don't understand what's going on with our bodies and things begin to creep up that's denying us from the ability to conceive, we are beginning to realize that our hearts are breaking and our homes are actually breaking. And so the Black community should care because there are people who are hurting because they are not being able to conceive, and that they're maybe conceiving but are having miscarriages. And so it disrupts life, and it disrupts the essence of what we were made to do. We were made to be strong, and we were made to be able to empower our families and to go out and make the world a better place. But when we're not able to procreate and have children, something is missing in life. A part of our life is missing. And so we should care because we should care about one another.
Yeah. We talked about fibroids. According to the University of Michigan, nearly a quarter of Black women between 16 and 30 have fibroids, compared to about 8% of white women, or rather 6% of white women. So there are your statistics there. L'Oreal, I want to talk about something you mentioned when we talked about why should Black people care about infertility. You mentioned that you were the only one sitting in the waiting room that was Black. What waiting room are you referring to?
Like the name of the clinic? Are we going?
No. I mean, when I say what waiting room, like, were you in labor in the waiting room, or like what specific purpose was?
It was for that particular one, is a consultation for the infertility. So speaking of the fibroids, I had a myomectomy back in 2017 to remove, I think it was about 27, almost 30 fibroids. They're like, oh, you have the uterus of someone who is 3-4 months pregnant without being pregnant, and got the surgery to remove those. And as a result, what they believe is the scar tissue from that is what caused the fallopian tubes to be blocked, thus causing the infertility. And so we were chilling, waiting in the waiting room for the consultation to get everything started. So it's not like, oh, I decided I'm going to do IVF and I'll just roll up into the doctor's office. A lot of appointments, a lot of blood work, a lot of genetic testing and everything else to just even get the process started. And that was the one, because there's a lot of myths, I think, around it as well. Like infertility or IVF is expensive and insurance doesn't cover it, or we can't afford that. I know those were my initial thoughts. And so going there and waiting and looking around, like I said before, it just amplifies that isolation that you feel, because you already think something's wrong with me and my body's not acting the way that it's supposed to. And now I'm kind of in this alone as well, because I don't see anyone who I identify with or that looks like me as well.
Dr. Loudon, why do you think, I mean, L'Oreal, she mentioned great points as to why maybe she was the only Black woman in the waiting room. And I'm assuming that's what you mean by I was the only one in the waiting room, right, L'Oreal?
Yes.
I don't want to misinterpret what you're saying. So she mentioned that Black women think it's too expensive, or maybe there's just no way around it. So why would she be the only one in that waiting room? Why won't Black women go seek infertility consultation at the least?
There are several things hypothesized that we know is the reason that lead to it. One of them is Do you have that social support? Do you see people in your family talking about infertility? Do your friends talk about it? Do you know someone who's even gone through it? You probably do, but we don't talk about it in our community because we feel that it's taboo. I'm less of a woman or less than a man if I can't do this, and that's not the case. And me and Regina had talked about this last week. Is infertility, whether it's from fibroids, PCOS, or you have Asherman syndrome from scar tissue, this is like any other health disorder or health disease, hypertension or diabetes. You had no control, you are not at fault, and we have to kind of get that portrayed to the community. So that is one thing. So not having that social support, knowing people who look like you, because it is a trust thing. You know, if we don't know somebody who's done through, we're less likely because of our past histories to be able to trust that this is something that we should do and can do. She brings up affordability. Yes, unfortunately in the United States, infertility is not covered in every state. However, likewise, I've gone through it, not infertility, but I did fertility preservation or social freezing as some call it. And there are things that we just don't know, but you won't know unless you ask. There are grants out there. There's financing. So like
whoa, pump the brakes. There are grants, there are infertility grants for Black women?
Yes, there are.
Yeah, can I jump in and add to that a little? You know, I belong to Resolve, the National Infertility Association, and I just want to put out there that actually some states cover.
Yes.
I'm in Delaware, that's one state. So 16 states actually cover or have some sort of insurance to help couples expand their family. So that's the information that needs to get out there, that yes, it can be expensive, but there are states that help. And as Dr. Loudon just mentioned, grants as well. But yes, there are people who have been in different states and they've been advocating for it to the point where the state said legislators and senators will just say, hey, we need to do something about it.
That is incredible. Who knew there were infertility grants? Who knew that? And then in 16 states, you say.
We're actually up now too.
Arkansas, Maryland, Delaware, New Jersey, New York, Connecticut, Rhode Island, and the list goes on. It's just
Illinois.
Yes.
We are okay. We're going to get a list of those 16 states because I think it's imperative that women who are watching or who tune in on demand to rewatch this show know that there are 16 states where insurance can partially, if not fully, cover infertility treatments. That is amazing news in the first 11 minutes of this show, ladies. We are coming right back.
Yeah.
Don't have a baby. We coming right back, y'all, on the Tammi Mac Late Show on Fox Soul. Welcome back to the Tammi Mac Late Show on Fox Soul, where tonight we are touching on infertility in the Black community. Bet y'all didn't know you could get grants to get some fertility treatments out there. Bet y'all didn't know there are 16 states where your insurance can assist you with infertility assistance. How about that? Before we go any further, because
Black women.
Wait, say that again, Regina. 2
of those grants were created by Black women. One is Fertility for Colored Girls, which is founded here in Chicago by Reverend Stacey Edwards Dunn. And the other is the K Foundation, which doesn't just serve people of color, but it was created by Camille Hammond and her family, and they are a Black family. So those grants, we're out here getting it done. Aside from just those being available to us, when we don't have it available, we're making it available.
Yes.
You know, you Black women are some strong Homo sapiens.
And just to add to what the ladies were saying, in the state of Tennessee, we don't offer, it's not mandatory for employers to offer insurance for infertility, but I'm part of an organization called Tennessee Fertility Advocates. And we're actually in the process right now of getting a legislative bill written so we can take it to get voted on, so we can have infertility insurance in our state. So we are actively working on that right now in the process.
It's good to know. It's good to know.
Number 17.
Before we move on, I have to ask the most basic question of all, so that we're all on the same page. What exactly is infertility? How do you define it? And anyone can take that.
Well, it definitely. Regina, Doctor.
I was just going to give you the medical definition, but there are 3 definitions. So for somebody who's less than 35, it's a year of trying to conceive actively without having a conception. If you're over 35, it's reduced to 6 months of actively trying and not having a conception. And then you have those who are, it doesn't matter your age, if you have something already like PCOS or you have fibroids, you don't have to wait that 12 months or that 6 months because you have a reason that you're not going to already have, we call it fecundity, or have a conception easily. So you don't have to wait that 6 months or 12 months. If you already know something is going on, like your doctor's told you have fibroids, or PCOS, you can see a doctor at any point when you know you're actively ready to conceive.
You're saying PCOS?
Yes, polycystic ovary syndrome,
Okay.
and it's abbreviated PCOS.
And what is
one of the most common reproductive endocrine disorders in women of reproductive age. And so PCOS is where women have, there's 3 criteria. They only have to meet 2 of those 3. So they have irregular periods, or they have polycystic appearing ovaries, meaning when we scan them, they have multiple follicles that are trapped in the ovary because they don't ovulate every month, those eggs, so they're trapped at the surface. Or they have clinical or laboratory findings of elevated testosterone. And that can either, if it's on lab, if it's clinically, we look for, excessive hair growth, maybe on the stomach, inner thigh, chest, or they can have acne. So those are signs of testosterone being elevated. And if we can't see that, we'll draw blood. If you have 2 of those 3 criteria, then that is a diagnosis of polycystic ovary syndrome. And that's one of the reasons why a lot of women have failure to get pregnant easily, which is one of the things that is actually very easy to be treated in some. In some, they have a more severe form that needs a little bit more extra work. And Regina brought that up. It's more for that patient, it's more than just PCOS. And for a lot of these infertility things, it's more than just having babies. This is not a silo thing. This is just not about having babies because it affects your whole body. So when you have PCOS, you can have cardiac disease, you can have diabetes, you can have issues as far as cancer, because if you're not having regular periods, you're at risk for endometrial hyperplasia that causes cancer in the uterus. And if you have fibroids, same thing. So you're going to be at risk for anemia. That tumor can grow big enough where it can affect other organs. So this is not just something just related to having children. This is bigger. And when I love Dr. Jones or Francis Jones is here, because this affects you mentally, physically, emotionally, spiritually, financially. Everything that makes us who we are is impacted by infertility.
Wow. Let's go to some of our soulmates because they are weighing in here. Gentle Killer says, what about the medical experiments we went through, still going through? If they, he put it in quotes, if they left us alone, we would be half the United States population by now. Is that, Regina, you're shaking your head. So are you feeling what Gentle Killer says?
I don't fully agree with the idea that we would be half the population, but I will say that part of our mistrust, which leads us to not have the best relationship with the medical community, does lead back to those experimentations. The doctor who is considered the father of gynecology performed his experiments, which led to his groundbreaking research on unmedicated Black slaves. So for you to treat enslaved Black women and say that you received their consent, and that led to you creating things such as the speculum and all of these other things, they didn't own themselves. So how can we trust that you had their consent? When we have things such as the Tuskegee experiments, where you withheld viable information and medication from those who were afflicted with a disease, we have a valid mistrust of the medical community. And so that's part of why we don't have a great relationship with them. And then we don't go to the doctor. So we have things such as what Dr. Loudon was saying, where we don't go, and then we're thinking, well, I didn't get a period. Yay, I didn't have to deal with that. And we're not realizing that that is an indicator. Your period not coming is not okay. It means something isn't working properly. Or if you're noticing that there are things happening with your skin and you're thinking it's just a skin issue and you're not knowing to ask the questions that would tell you that there's something hormonally off that is causing you to not ovulate. And then when you get to the point where you do want to have children, then you find out that you can't. And it's like, why didn't anybody tell me? So there are some distrusts that we have that I feel that there are some doctors who are really working very hard, especially in this community, in the infertility community. There are some doctors working really hard to try to bridge that by having Instagram lives, by connecting with us who are in the infertility space, and they're trying to fix it. But that mistrust has led to a lot of situations where we're finding out at the last minute, oh, this was a problem and I could have fixed it and I didn't know.
Yeah.
And we also
and we cannot forget to mention Henrietta Lacks, right?
Yes, the HeLa cells.
for whom we would not have IVF without her. We wouldn't even have IVF without the experimentation on her cells. So
this is why it's important to tell people that maternal health does not begin the moment you're trying to get pregnant. Maternal health begins the moment you start your period. And you should not wait till your late 20s, 30s, or 40s for a child. You can take charge of your fertility health now. Ask your doctor to check levels, your FSH levels. Find out if your fallopian tubes are blocked by requesting a HSG, getting your AMH levels checked, your cervical mucus, all those things. Have your husband or your partner have his sperm count and the motility checked as well. But maternal health does not begin the moment we have problems or issues getting pregnant. It begins the moment we get pregnant. And that's the information that we should tell our young daughters and our women, period. Don't wait, get it done now.
Well, I want to push back a little bit on that, Nichelle, because it sounds like you're saying as soon as you get your period, start checking yourself to see if you can have a baby.
No, I'm not saying that. I'm saying you should always take your fertility health, your health period, serious to the point where you don't, it's not about trying to find out if you're having a baby or not having a baby, but trying to find out if you can get pregnant, but finding out whether or not you have those fibroids or your blood levels are so high that you're not, you don't have the follicles that you should have in order to produce enough eggs each month. So it's not to shame folks for not knowing, but I would love to encourage people to start looking now before you even try to reproduce with your partner.
Okay.
I think on that note, I'm sorry.
No, go ahead.
I think on that note, it's like picking up what she's saying. I think it's just more, this is kind of what we've all been saying in a roundabout way. It comes for talking. We don't do that anymore. I grew up with my grandmother in the house, so I sat around listening to the old ladies talk, but you don't listen to the women talk about miscarriages or what's happening. Know your family history. Talk to them like, what is a normal period? Like, in the first 2 years after starting a period for puberty, your periods can be irregular. That's not PCOS. We actually cannot diagnose you as PCOS at the age of 16 or 15 because we know you have irregular periods while your hormonal axis is trying to regulate. But you don't know that if the women in your family, and I put it on the women because men don't want to talk about that at all. But you have to talk to these. They should. We put it all on the women and the moms.
Yeah, doctor, men should also know about periods. Men should also know about the regularity of them and why they are here.
Who are they going to learn it from? They got to learn it from a woman because they're not going to seek it on their own.
Well, I'm just saying because men have daughters.
Yeah.
You know what I mean? So men are also responsible for raising their children, whether it's a boy or a girl. I do agree that this is a thing that a woman should share intimately with their young girls. But I also believe that men should know.
Yes, they should know.
And it's unfortunate that we take the educational value away from men. And for too often in the Black community, we lay it all on the Black woman. So I'm not gonna lay it on the Black woman tonight. Men should know too. If you don't know when your woman's period is, shame on you.
You better know.
Yeah, I know they know that. I bet you know that.
Yeah. Yes, but just
when to come tapping around on that butt at the middle of the night. You know what? You know when and when not to do that. Let me grab these soulmates real quick before we go to break. Princess Robinson says, it is true. I have been diagnosed with PCOS and it caused the weight issues and lots of things. I do not have children. And at 51, my doctor does not think I should even try to have children. Yeah, okay, I do. I think we should discuss that when we come back. Incognito says, are increase in estrogen our increase in estrogen-induced foods is a contributory factor in all these tumors that cause infertility. I definitely want to talk about that. And then Deborah says, we have to do our own research and educate ourselves and speak up on our own behalf, especially if a doctor is not addressing our needs.
Yes.
Doctors are great, better than most more. Oh, okay. I've never heard of a naturopathic doctor.
Mm-hmm.
Oh, okay. I see Frances shaking her head like I know about those. So when we come back, we got a lot of talking and discussing to do here. I think this show's definitely going to need a part 2 to get in all the information and education we need to give, right? We're coming right back on the Tammi Mac Late Show on Fox Soul. Welcome back to the Tammi Mac Late Show on Fox Soul. Tonight, we're tackling infertility in the Black community. So look, if you want to see more Fox Soul content, subscribe to our YouTube channel and make sure you hit that notification bell so you can get the best updates on all of our new videos and live shows. As a matter of fact, plenty of people are in our chat room right now. You can chat live with us. We chat back. And don't forget to hit that thumbs up button and tell us how you feel in the comment section. Tonight, I have with you talking about Black women and infertility, but we're going to get to Black men as well, with scientist and reproductive endocrinologist, Dr. Erica Loudon, journalist and board member of Resolve, the National Infertility Association, Nichelle Polston, writer, editor, and speaker, L'Oreal Thompson Payton, and speaker and author Frances Jones, and professional youth librarian and the founder of the Broken Brown Egg, Regina Townsend. Frances, I want to talk to you about the stigmas, the taboo, this Black community thing. Like, I think it was the Dr. Loudon that mentioned that it's so taboo in the Black community when we talk about fertility. But my question is, why is everything a damn taboo for Black people? I'm like really getting sick and tired of this taboo with Black folk. Homosexuality is taboo. Entrepreneurship is taboo. Not going to church is taboo. Everything is taboo with us. Is there anything that's not taboo? We can't talk about why we can't have a child because it's taboo. Our periods are taboo. Having sex is taboo. It's like, come on, Black people, when are we gonna get it together? So, Frances, why do you think that this situation with infertility is a taboo in the Black community?
Well, for starters, when we come from an age, and I come from being raised by older parents, and so my parents, my mom especially, she didn't really talk about child rearing as far as how to get pregnant or the different things that went on physically with a woman's body. And so because these things are not normally talked about, and because the Black community has this stigma of being extremely fertile, I look at my family, my mom, she was able to conceive 10 times. Her mom was able to conceive multiple times. Her sisters, one conceived 10 times, one conceived 7 times. All of my sisters were able to conceive, but not one time was I able to conceive, not once. And I dealt with infertility. I'm still dealing with it, but I went through an over 20-year journey. I kept that to myself because I thought something was wrong with me. All of my sisters have children. My mom, very, very fertile. But I felt like I had done something to deserve it. So we get to a position where we think badly of ourselves. We begin to degrade ourselves. So let me make it personally. I degraded myself. I thought I was damaged goods. And so you don't want anyone to see that sad, hurtful part of you. You hide it because you want people to think you're like everybody else, that you are not going through all this heart-wrenching experiences. No one wants to talk about it, but that's why it's wrong to not talk about it. It's freeing to let people know. Now, you don't have to let people all up in your secret closet. I'm not saying that. But to get to the point where you're not ashamed to tell your story, when you think about it, the only thing that really comes forth with infertility is that there's a part of your body that's just not operating as it should. People have high blood pressure. It means something is not working right in the body. People have high cholesterol. There's something not working in the body. It's the same thing with the reproductive system. Those organs, there's something's going on. Now, Nichelle, she mentioned something, and I just want to kind of piggyback on that. She was talking about making sure that you understand what's going on in your body. As soon as you can get tested, that's reasonable for you to get tested. Well, like I said, my mom didn't talk about that in my family. So I was having terrible, painful menstrual cycles. I didn't share with anybody. I kept it to myself. I thought it was normal. But it got to the point where I was in so much pain, I literally had to crawl from one room to another. I could not walk. Years passed by, and this is when I was in college. Years passed by. I got married, ready to start a family or add to my family because my husband, he had full custody of his daughter who was 4.5 years old. I wanted to be able to add to the family. I thought there would be no reason that I couldn't. But then after being tested, I was diagnosed with stage 4 endometriosis. I did not even know what endometriosis was. I didn't know it. But when I had a laparoscopy done, the doctors told me that and I had it done twice. The first time that my ovaries were literally glued to my back. There was adhesions everywhere. It was so horrific that the only thing that they could do was unstick it, my ovaries. But just think about it. If I had started trying to find out what's going on with this pain, why am I hurting like this? Is this normal? Because I didn't talk to anybody about it. I kept it hidden.
What was it, Frances, that freed you up? What was it that made you, because you're sharing your story today. So what was it that said, this can no longer be taboo? This has to end today, right here, right now with me. I'm sharing my story. What was it that gave you that courage?
What gave me the courage was a few things. Number one, I began to realize that because a part of my body wasn't operating as it should, does not make me less of a woman. I began to be free because in my mind, I told myself I was damaged good. No one else did that. I did that. And so when I began to realize the real cause of my problem was just something wasn't functioning right in my body, that freed me. That helped me to realize that I was not in a position of a deficit. And I began to realize that there was a beauty in my life. I was giving up happiness. I was giving up peace. I was giving up joy. I was hurting, but I wore a mask. I would smile with everybody. When women would tell me about their pregnancies, I would genuinely be happy for them. I would applaud. But then I was aching on the inside. I didn't want to hurt anymore. And more importantly, I didn't want anybody else to go through what I went through. And if there was any way that I could use my life, my example, my mistakes to help somebody else be free, I'm telling everybody. I don't care how someone may look at me, because there's still people that have that mentality. That's secret. Keep that to yourself. Yeah. Don't be telling your business. But how can I help somebody? See, I went through this for a reason. I remember reading a scripture when I was going through that in all things give thanks. But how could I give thanks for being in my world barren? Because I was never able to conceive. But as I began to grow, and as I began to learn, and as I began to understand, I really saw light in that scripture. Because if I had not gone through what I had gone through, I couldn't help anybody today. So yes, there's a gratitude in being able to use my life, my pain, my hurts to help somebody else be free. And if I can help one person not go through what I went through, just one is worth it. So what made me try to share is just so I don't want nobody else to go through what I went through, to hide their pain, to feel like they can't talk to anybody, to feel like they're alone. You're never alone.
You are never alone. Couples. Yes.
So the statistics is either 1 in 6 or 1 in 8, because depending on who you're listening to. But regardless, so how many people on this panel right now? About 5 or 6 of us, right? And if you look at that stats, 1 in 6, one of us would have been dealing with infertility. I know I was one of them.
L'Oreal, I want to ask you, there are a lot of microaggressions that come with a woman trying to deal with her infertility. What people say, if you will, well, you could just adopt. Can you share some things that maybe you were told?
much time do we have until break? Because it's a list. It's a long list, even getting to the point of treatment and the consultation, going to doctors and having them not believe me about the fibroids. That was a 3-year journey in and of itself, because they're like, oh, it's fine, or try this birth control. Oh, I'm telling you, I have a family history of fibroids. I know what the issue is. Why don't you believe me? And so that was hurdle number one. When I decided to share, for the very reasons that Frances mentioned as well, like, I don't want anyone else to have to go through this alone. And so when you share, and that's a very vulnerable thing to do, is like open up and share your story. And people have good intentions, and that's what I try to remember, assume positive intent, but oh, you should just adopt, or just pray on it. And again, well-meaning people, or you're trying too hard, you need to relax.
That go them
right?
black people again. That go them black people again. Just pray on it. Jesus gonna bring it. Look, ain't nobody said Jesus wasn't gonna bring it. Ain't nobody said I wasn't praying.
Exactly. Right.
But I got to do something in reality too.
I'm like, God made the doctors, made the signs and everything. It was one of the same conversation when I started going to therapy. He's like, you have a family and husband and friends who love you. I didn't say I didn't. I can go to therapy go to church on Sunday and go to therapy on Monday. You can do both, in the same way that I am a believer and I'm also going through IVF, and you can do both. So I think people have to respect other people's decisions and think, I'm a very smart woman. I graduated college, I have a degree. And so right now we are choosing the option that makes the most sense for us. I have done the research. And so again, I know people mean well, but sometimes it's just not, it's not what you need to hear. And I've had that conversation with some people as well. It's like, I thank you for that. And this is what I need right now. I don't need this. I do need that. And so it's also advocating for yourself and sharing with people, showing them how to show up for you, as well as friends, colleagues, family, etc.
Yeah. Well, right now we're going to make two choices. That's going to include going to a commercial break, but it will also include coming right back on the Tammi Mac Late Show on Fox Soul. Welcome back to the Tammi Mac Late Show on Fox Soul, where we are talking about infertility in the Black community. Our soulmates are weighing in heavily here. Tammi, infertility is taboo because it's considered a shortcoming, since Black women are stereotyped to be these healthy baby makers more so than any race or culture. Unapologetically, Pam says, for the panel, how does choosing to not have children play into the conversation on fertility in the Black community? Does anyone get that question?
Yes, and it's important because, like I said, it's reproductive health and justice. So you should have the right to choose whether to have children or to have them or to not have them. And I think that this concept that we can just say what we want to say. See, the crazy thing is we talk about how taboo things are in the Black community. Mm-hmm. And yet we have such a familiarity with each other that we can sometimes overstep bounds in what we say. So with what I was saying in terms of people saying just adopt, like adoption is free and those kids are consolation prizes. You also need to watch your mouth, because if somebody has chosen not to have children, that's their right. And you don't know what strength it took for them to make that decision, for you to then come in and take that empowerment away from them. And both sides are valid. There are also things about us as Black women where we were taught you go to school, you get the good job, you do what you have to do, and then you don't find Mr. Right or you don't find Miss Right. And so now you're looking at, like the person said, they're 50 or whatever, and you're thinking, well, now what? That person deserves the dignity and respect of you not getting in their business, the same as the person who is trying. And I think that's part of it, is that we have to learn how to respect each other's choice. A lot of times, historically, we've had to make decisions based on groupthink, based on what protects us, based on what keeps us close as a community or as a family. And those decisions have sometimes led to us having these issues with what is taboo, what we don't talk about, and also with the things that we want, but we don't feel deserving of wanting. If you come from a family where you've learned that everybody in your lineage had 10 kids, 9 kids, 12 kids, and you don't want any kids, that's a source of strain also, because you again feel like, well, what's wrong with me? Why don't I want, or why can't I want to just live my life the way that I want to? And so I think that is just as important. Somebody just wrote me about it this week, is the concept of that there's still a grief there. If you chose not to have kids and people are constantly making you question your own judgment. There's grief. And when you want them and you can't have them, and you're wondering why you didn't know all this ahead of time, or what you could have done, or whether or not you broke your body somehow, there's grief. And so, like what Francis was saying, all of this, there's a mental capacity to this that we have to keep in mind, and it's inclusive of respect and dignity of choice.
Yeah, that's another taboo in the Black community, being a single mother. A single father, not so taboo. A single mother, taboo.
Celebrate it.
Lord Jesus, our soulmates. Yes, L'Oreal, this is so important. A person can have Jesus and still be experiencing infertility. You can see a doctor and pray. These are important balances. To be honest, I hear more issues with infertility with my Black American friends compared to my African friends. Oh, you just dropped a bomb on us there. The United States just dopes women on hormones, birth control, or other drugs. Oh my goodness. We going to Africa with this tonight?
Not
Okay.
necessarily, because there are organizations in Africa, and I get multiple emails constantly from women in Africa who are from various countries on the continent who are trying to find connection and trying to find resources. And they're dealing with even stricter taboos in many cases, because culturally it is seen as disrespect to a family. And it can lead to more than just, oh, we couldn't get pregnant. It can lead to you being divorced. It can lead to you losing your family. So there are issues in Africa as well. And sometimes,
yes, I wanted to say, you know, sometimes in Africa, the rules are a little more strict.
yeah,
And it would serve a woman well not to share that she is experiencing infertility in that country.
Absolutely.
Dr. Loudon, you want to, Dr. Loudon, I want to go back to the question of the 51-year-old woman, if you will, because I think she really was seeking some sort of consolation here, and maybe you can help her with it. So I will repeat what she said. It is true, she says, I have been diagnosed with PCOS, and it caused the weight issues and lots of things. I do not have children, and at 51, my doctor does not think I should even try to have children. As a doctor, is that something that you should tell a woman ever?
Well, no, I think you should never tell a woman that without prefacing why you're saying that. And so it has nothing in this, and I don't know her doctor, but I'm assuming that the reason why they might have told her they didn't recommend trying is several things. Yes, she has PCOS, and so she probably at 51 has plenty of eggs still remaining, because women with PCOS, at 51, she probably has an AMH of somebody who's 30 because she never ovulated those eggs. But we know as women, we're born with all the eggs we're ever going to have. And so unfortunately, every month when we're going through our cycle, or they're sitting in our body, the mechanisms that kind of regulate the DNA doesn't perform effectively anymore. So you have higher rates of chromosome abnormalities after age 35. So the doctor may be just trying to set her up and then tell her the reason why. Yes, you can probably conceive at 51 with PCOS because you have eggs, but there's a higher rate of miscarriage because you have higher rates of unhealthy eggs. And then the second thing is maternal health, which is a big thing, Black maternal health disparities, because we die at a higher rate when we're pregnant over the age of 35, even when we're 30. So at 51, she's at higher risk for preeclampsia, gestational diabetes, hypertension, having to have a C-section. And so it shouldn't be a no, though. I think you should give an attempt, but that patient can't just go straight to getting pregnant. She has to see a maternal fetal medicine doctor who's a high-risk specialist who would clear her and say, let's do this full physical, make sure you are healthy enough to have this child and not compromise your own health, because we want a healthy baby, healthy mom. We just don't want to get a child here and not have a provider for it. So
would they suggest that she lose weight?
Possibly. And it's just, that's the same thing with even like with our PCOS patients. If they lose 5% of weight, some studies show that you can spontaneously start to ovulate. Even with 51, she's PCOS, losing a little weight. They might just make sure that her insulin or her diabetes, if she has it as a result of PCOS, is controlled and regulated before she gets pregnant, because that baby is at risk for hyperglycemia, being large gestational age, meaning you can have a 9-10 pound baby with the vaginal delivery, that size risk of shoulder dystocia. So there's a list of complications that doctor should have provided her. Like, these are my concerns. I don't say no, but let's get through these things and check out what can we do to help you have a better outcome. Because right now at 51, PCOS, obese, I don't know what other things, you're at high risk of having complications. And that is the major concern. Because the wonderful thing with IVF that I mentioned, she might have higher rates of mutated eggs, where we have something called pre-genetic testing. So she has 10 eggs, say, we get 5 embryos, maybe 1 comes back normal because we can test the area of the placenta and make sure there's 23 chromosomes from mom and 23 from dad, and there's nothing like Down syndrome, extra missing chromosomes. So we have that technology now. So now it's more about just making sure she is healthy enough to be able to go through a pregnancy successfully. Okay. So I think that's a very loaded question.
She's responding. She says, my doctor said that I would die. I also have endometriosis.
Adenomyosis or endometriosis?
No, the meiosis.
Endometriosis?
Adenomyosis.
Adenomyosis, which is it's cousins of endometriosis. All it is where those glands that should be inside the uterine cavity. For endometriosis, it goes outside the fallopian tubes and implants inside the pelvis, or even can go as far as the lungs and causes inflammation and scarring, like Francis mentioned. With adenomyosis, those glandular tissue goes into the muscle of the uterus, and so the uterus gets soft and boggy. And so with pregnancy, you're at risk for bleeding. So that's why, the doctor shouldn't tell you to die. You could die from it. You have to get a follow-up with a maternal fetal medicine doctor, high-risk doctor for obstetrics. Get clearance first. And if there's some things you can do to optimize your health, then it's a potential, but it's not a hard stop no. With IVF, some of the clinics do have an age restriction. So
we got to take a quick break and we'll come right back to wrap the show up. Hopefully I can slide in 2 more questions we got here on the Tammi Mac Late Show on Fox Soul. Welcome back to the Tammi Mac Late Show on Fox Soul. Regina, what can you tell us about the broken brown egg?
It is a resource. I don't consider myself an expert, but I'm an expert on me and my experience and what it was like dealing with infertility for 7 years before we did IVF, going through a disrupted adoption, all of the things that I learned on this journey about mental health in the Black community, about foster care and adoption in the Black community, about maternal mental health, about postpartum, about all of these things. And in many of the doors that were open to me, I saw myself alone, and I realized that I didn't want that for anybody else. Like Francis said, it's important that you see yourself represented, not just to see the success stories, because the baby isn't the success story. When I get up and I use coherent sentences, that's my success story.
Francis, speaking of telling your own story, you are in Heart Desires Coaching.
Yes.
Talk about it.
So Heart Desires Fulfillment Coaching is a coaching practice that I have. Basically, I do 2 things. One is I coach people who are dealing with those negative emotions related to not being able to have children or having challenges with having children. I help them with those negative emotions to get past those stigmas, to be able to take control back over their lives where they no longer are letting infertility control them.
And you have a book as well, right?
Yes, my book is coming out March 25th of this year. It's called Overcoming the Emotional Stigmas of Infertility, Barren but Not Ashamed. Basically, I talk about my life, my story, and what I used to get out of that tormenting place that I was in.
L'Oreal, the newsletter, please. How can we find it?
Yeah, at ltinthecity.com, every Wednesday morning, I send a motivational weekly newsletter that's just full with inspiration, lessons learned, such as these, my journey in IVF, and other musings.
Nichelle, tell us about the work you're doing with Resolve, please.
Yes, I have my own fertility journey has led me to become a board member and advocate for women, especially Black women. I am the founding member of a diversity and inclusion council with Resolve. And so I enjoy meeting and talking with women all the time, especially in our community, to get them more involved. So I thank you, Tammi, for bringing this up, for providing this platform for all of us. The one thing I want to add really quickly, infertility does not mean you've never had a baby. There are women who are suffering from secondary infertility. That means they've had a baby once and they have not been able to conceive ever since. So that's another thing to keep in mind.
Dr. Loudon, talk to us about VIAS Fertility. We got 30 seconds out here.
Okay, so VIAS Fertility, we're all over the U.S. really soon, but what we're doing is we're working with women with fertility preservation who have cancer diagnosis, helping them freeze eggs and have embryos for when they're cancer-free and remission. We're also doing Bios Fit, so women who are having some issues because of weight, we're going to help you get on track so that we can get you to your healthy weight and healthy goals for your baby outcomes. And then overall, we are here for our males. We can't forget our males because we're the only infertility institute that has a urologist on staff in-house. We don't have to outsource it. So we have lots of things and we're very innovative. And that's one of the things that I loved about Bios that made me join it, because they're not afraid to try new cutting edge things to help our patients get to their goals. And we are now in more culturally diverse, including access to care, different creative ways, because we realized that has been the problem, is that the community didn't feel like they had a representation and that we can speak to their personal issues.
Well, I'm so happy
my job.
All of you have represented tonight and spoke towards the representation of Black women and men who suffer from infertility. This definitely deserves a part 2. So we'll see you again probably next week. L'Oreal, Nichelle, Dr. Loudon, Francis, and Regina. Until tomorrow, everybody, it's a blessing to be in your box on the Tammi Mac Late Show on Fox Soul. Bye, y'all.